Professor Portman, we are now at the Marine Laboratory of Arcachon of the University of Bordeaux. It was here over 50 years ago that you first performed your physiologic studies of the endolymphatic sac. Can you please tell me why you picked the ray for this study and why you became interested in the endolymphatic sac?
Yes, it is in 1920. In this place, just at this laboratory, I made my first experiment about the endolymphatic sac, and I took the film of the operation exactly here on the table. I see the table with the fish, and I chose ray, the Leiobatis pastinaca, while the endolymphatic sac of the animal is open in the sea, on the superior surface of the head of the animal. And it was possible to make a cut ray at the level of the small canal, which put in communications labyrinth with the sea.
Dr. Portman, this is a torpedo, another type of elasmobranch that you operated on. How did you become interested in the endolymphatic sac in all animals? Why did you study this portion of the inner ear?
I took this animal because you see on the surface of the head you have the opening of the canaliculus endolymphaticus.
Yes.
The small communication with the sea. And I believe it was the best animal for the experiment because it was possible to stop the action of the endolymphatic apparatus without a trouble for the internal ear, without touch the internal ear, without trauma.
Yes.
You understand?
Yes, I understand.
And it is for that I choose this ray, the Leiobatis pastinaca, the torpedo.
These were very unusual experiments on the endolymphatic sac of these fishes. What results and observations did you make at the time?
Yes, I suppose that the closure of the canal produced high drops in the labyrinth. And this hypertension, the endolymphatic fluid, must produce in the animal disequilibrium. And I have seen in the aquarium the fish which was disequilibrated and it's not possible to go in a right way, was turning and on the horizontal plane and also on the vertical plane. And was the proof that the high drops in the labyrinth produce trouble of equilibrium.
This would be a very interesting movie. I think we will look at your old movie now.
Yes. I use a paraffin, injection paraffin canal, and also a cautery, a cauterization. And after, I have seen the animal which give all the signs, all the aspects of disequilibrium. He could not go in a straight line, he was obliged to turn, like if he has a vertigo, or on a vertical plane, he was jumping out of the water. Then it was for me the proof that my hypothesis was true. And I made this experiment several times during several years, and the fishes were sacrificed immediately after, 1 month after, 1 year after, 2 years after, and to see by microscopic examination the modification by the. Sometimes I have seen that the vertigo was temporary. And when I see, after I take the animal, when I make section of the head, in this case, the plug of the canaliculus made by the cautery has disappeared. And there was a proof that when the canaliculus is open again, the function of the internal ear is normal again. And sometimes the animal was with disequilibrium during several months. When I was sure that my hypothesis was proved by experiment on animals, it was necessary for me to try an experimentation on man.
Professor Portman, your experiments on elasmobranch inner ears and the clinical implications were quite provocative. We redid your basic experiments at the Lerner Marine Laboratory. Based on Portman's original experiments using elasmobranch fishes, we utilized the lemon shark, which was readily available to us at the Lerner Marine Laboratory on the island of Bimini. Lemon sharks are continuously swimming and in motion. During the anesthesia, the lemon sharks showed a disequilibrium during the second stage of anesthesia, which can be seen now. This is the only time during the experimental work that any type of disequilibrium was manifest. The third stage of anesthesia showed no such manifestations of disequilibrium. During the operative procedure, the external orifice of the endolymphatic sac can be readily identified by its increased pigmentation. After flaps are turned, the endolymphatic sac itself can also be readily identified by its grayish pigment. It can either be excised or a suture ligature placed around the external endolymphatic duct. After surgery, the experimental sharks were placed in small concrete pens approximately 6 feet by 8 feet. There was no evidence of gross disequilibrium or episodes similar to vertigo. Because this was contrary to our expectations, we planned to take these post-operative sharks back into the open sea pens and photograph them in their natural habitat to see if the phenomenon was at all related to the size of the pens. Here in the large sea pens, our tag sharks are swimming quite normally. From below the water, it can be seen that there was no evidence of any disequilibrium. These sharks post-operatively, immediately post-operatively, and also observed at 6 weeks and up to 8 months post-operatively, manifest no acute episode of disequilibrium or any problem swimming. We then felt that they have such good visual perception that they may be able to overcome this with their vision, so we inserted black cellulose over their eyes, and here is a normal lemon shark without the surgery, and he shows evidence that he cannot see. This is demonstrated in several swimming sequences where he continually bumps into things. This is definitely abnormal swimming behavior for the shark, but can be attributed solely to his inability to see. The lemon shark also rarely comes in direct contact with another animal, but this blinded lemon shark will touch this stingray, and this is extremely abnormal. We then put these blinders on the experimental animals and put them back in the open sea pens. There was no difficulty swimming other than lack of visual perception. This particular shark is having great difficulty swimming across the area he wants to because he cannot readily see this net. This is also quite abnormal, but is not a manifestation of disequilibrium. Here the shark actually gets caught in the net trying to swim through it. We then tried the experiments using stingrays, which are another form of elasmobranchs and quite similar to the animals originally used by Portman. Here the normal stingray goes up the side of the pen in a quite normal fashion, not due to the experimental conditions. An experimental stingray, having had his endolymphatic sac removed, shows no significant difference in his swimming pattern from the normal stingrays. To determine what a true disequilibrium would look like in both stingrays and lemon sharks, stingrays were given ototoxic dosages of gentamicin, an aminoglycoside antibiotic, and these stingrays became disoriented as to their position in space. Here's an example of a disoriented stingray who is trying to swim but is literally upside down and is unable to right himself. This lasts for a long time and was quite repeatable. We then did similar experiments in mechanical destruction of the labyrinth in lemon sharks. Here is a lemon shark that is several weeks after a bilateral labyrinthectomy. This animal is completely disoriented and is quite dependent on tactile stimulation as he swam over the bodies of the other sharks. And here there is no question that this animal is completely disoriented as to his position in space, and he is literally swimming in circles. This is a true manifestation of disequilibrium and is the closest thing to the subjective experience of vertigo that we can imagine in a elasmobranch. We never saw such behavior in chronic or acute experimental animals, which would suggest they had an acute episode of hydrops.